Whatever houses I may visit, I will come for the benefit of the sick, remaining free of all intentional injustice, of all mischief, and in particular, of sexual relations with both female and male persons, be they free or slave. The Hippocratic Oath.
What? Okay. Okay.
Bob? It's Julie Roy. Remember me? You helped me with my divorce. Remember? A couple years ago. You've got to help me.
I can't do anything for you.
No.
Lady.
You have to.
Well, you're not in jail. It's the only time a lawyer can help a client in the middle of the night.
Just push me over the edge.
Lady, please, make an appointment in the morning. Be cute. Is this my car here? Yeah, okay, you got the office number, okay? You can go home, and we'll see what we can do in the morning. I'm sorry, lady.
No.
Okay, Julie, how can I help you? What's the problem?
I went to the psychiatrist.
Mm-hmm.
He forced me to do things that weren't good for me.
Okay, like what?
He made me have sex with him.
What?
He made me have sex with him. He said if I did, I'd be able to relate to other men.
Julie, you mean sex therapy.
It wasn't therapy. It was sex.
Julie, let's back up a minute, okay? Why don't you sit down? Let's start from the beginning, okay? When did you start seeing the psychiatrist?
July.
Yeah, July when?
About 2 years ago.
Look, Julie, I'd really like to help you, but I have to know more. Now, what happened?
When I first started going to him, I was crying a lot. I was depressed. I thought he could help me. It seemed as if he might help me.
Why do you want to see a psychiatrist, Julie?
I can't manage things.
Don't turn your back to me. Julie, turn around. If you want to face the wall, please leave. Good. Let me explain something. There are psychiatrists who don't care if their patients spend an entire hour staring at a wall, not saying anything. I'm not one of those. I want to find out what's wrong with you and to take strong steps to cure you. Do you want to be cured? Well then, tell me what's bothering you.
I don't know. People, maybe. I have a hard time with people. I always seem to be depressed.
Bye.
July.
July?
My brother died in July. It was just 5 days before he was going to be 32.
Do you want to tell me about it?
No.
Tell me about it.
He got in the car and in his garage. He turned on the engine. And now he's dead.
And you're alive.
The next 2 weeks, Dr. Hartogs kept asking me questions about my family, making me remember things that were very painful. My boss, Adam, was real understanding about my coming in late. He knew I was having trouble.
If you can't handle these today, you can finish them tomorrow.
Oh, I think I can.
Hey, let's have a smile, huh? Ah, that didn't hurt, did it? You didn't crack your face or anything.
How's it going with the new doctor?
Okay. He cut his fee so I can see him twice a week.
Well, terrific. Listen, how about having dinner with me and Bill tonight?
I can't.
Julie, you gotta get out. You can't just stay at home all the time. Come on.
Okay.
How are you today, Julie? How's the work going?
Okay. Except for the girl at the next desk. She wrote something nasty about me, about my coat. She made fun of me.
To tell you the truth, I don't know why you wear that coat in hot weather. Although she shouldn't write nasty things about it. Yet when you wear it, you're asking for a teasing. So why don't you take it off? Mm-hmm. Go on. Take it off. Go on, Julie, take it off. Have you had any dreams since we last met?
Last night,
What did you dream?
I was in Africa.
Can you remember what happened?
I was being chased by black men with big bosoms.
Men with bosoms?
Well, men can have bosoms and women can have...
Can have what? Tell me, Julie.
People are all mixed up, that's all.
Homosexual, you mean?
So I started telling him everything. My dreams, about my family, about how when I was a little girl there was only one man who cared about me. Our black mailman, Archie. Archie cared.
Your ex-husband cared, at least in the beginning.
No, I was never more than a way you could stay in this country and get a job.
Mm-hmm. Did Dr. Hartog's care?
I want you to trust me, Julie. Take my hand. I'm supposed to help you. You said at our last session that you like to play the piano. Do you have a piano?
No,
Did your mother give you lessons?
my father taught me before he left.
Why don't you rent one? Maybe it would be good for you to start playing again.
I'd like that.
I used to play a long time ago.
You did?
Yeah, yeah.
Oh, I've missed you. Now, what's this about you seeing a shrink?
Yeah, I am.
You've been having a bad time. What's wrong?
I've been crying all the time and I feel depressed. I don't know whether I can go on with all this. It makes me feel guilty.
What's to be guilty about?
You know what I mean. The way people look at us.
Who cares?
I do. I can't help it. It's just how I feel.
I can change how you feel. We'll go up to Connecticut. My folks are in Europe. We'll have the whole place to ourselves. We'll swim and ride and walk.
Sure.
Oh, shouldn't be in your vocabulary.
Would you please call and cancel the appointment the next time you can make it?
So,
Why couldn't you make it?
I went to the country with my friend,
Your friend?
Pat.
You never told me about Pat before. Who is he?
She's just Pat. Pat is wonderful.
Fine.
She's so kind to me.
Are you in love with her?
Yes,
You never told me you had a lover.
we had a fight.
You're bright enough to know that it's important to me to know that you're homosexual.
I'm not.
No?
No. Pat is... is kind to me.
Would you go to bed with someone just because they're kind to you?
Maybe.
You have no will of your own? At our last session, Julie, you found it impossible to say any of the words that mean sex. Now, those words are dirty to some people. To me, they're not. I want you to say them. Come on, try. What are you thinking now? Come on. What are you thinking?
My mother washed my mouth out with soap when I said dirty words.
Julie, I'm not your mother. I want you to say the words. Come on, try. Come on.
One day I was walking through a cement tunnel, and I saw one of those words written in big letters on the wall.
What was the word? I want you to say it.
I started to cry and I ran home. And every day after that, I turned my head so I wouldn't have to see that word.
What was the word? I want you to say it. Come on, say it! Say it!
Oh, come on, Julie. I'm sorry, but to be frank with you, I'm still confused as to what your problem is and exactly what you want me to do. Just because you don't like the way a doctor treated you doesn't entitle you to be reimbursed, if that's what you want. I mean, you weren't a victim of some sort of,
I was a victim. Don't you see?
No, to tell you the truth, I don't.
I began to depend on him. I depended on him for all my decisions. What little there was of me left, he just took over. I tried to grow up, to do what he told me.
Such as?
Julie, I want you to take your coat off. Go on, take it off. Isn't that better? Yeah, that's better. You have a nice figure. You know that? Because you know that if you keep it covered up in that coat, no one can see you. We should take pride in our bodies. Stand up.
No.
It feels good to stand up and take a look at yourself. You want to overcome your inhibitions, don't you? Do you have them with Pat?
Yes. She helps me.
How does she help you?
She tells me what to do.
Why is it you do what she tells you, you not do what I tell you? Very good. You've just taken your first step to freedom. Freedom is frightening, isn't it? What do you feel about me, Julie?
I don't feel anything.
Let's shake hands. Hey. Doesn't that feel nice? My fingers wrapped around yours, helping you, protecting you. Julie, look at me. I'm going to cure you. Do you believe?
Yes.
Trust me.
I got hooked.
Julie, what do you mean exactly, I got hooked? Did he drug you? Did he hypnotize you?
No. I started to fall in love with him, I guess.
You guess. Well, did you or didn't you?
No. I don't know.
Yeah, but Julie, it's important that I know. Now, somehow, you and I have got to find this out.
I wasn't well. I couldn't really know what I was feeling. Don't you understand?
Look, Julie, I'm going to go get one of my associates who knows a little more about this sort of thing. Is that okay? I'll be right back. She keeps talking about a shrink, how he took over, how she has no will of her own, how she's totally dependent on him for all her decisions. I don't even know if I have a case here.
Bob, if you're talking about malpractice, I don't think you do. Not based on what you told me. I mean, it's one thing to go into court with a broken leg or an arm cut off, but I don't think there's ever been a case against a psychiatrist for psychic injury. It's like rape. How do you prove anything?
Look, I don't even know what I'd be trying to prove. All I'm saying is that... I mean, there's never been a malpractice against a shrink?
Not like this. You'd be setting a precedent.
We'd be setting a precedent.
If we won.
Julie, this is Lauren Plotkin.
Hi, nice to meet you.
Julie, I want you to tell Lauren what you meant by the doctor becoming more important than you. How he victimized you.
Well, I just let him... I depended on him.
Go on, Julie, please. It's important that Lauren hear all of this.
It's okay. We're just here to help you. Really.
Go on, Julie, please.
I'd like you to try the couch.
He didn't try to make love to me until one day.
Don't be afraid. It'll make it easier for you.
I don't like it here.
Why?
I feel helpless.
No one's going to harm you. Now, Julie, I want you to let your mind go. Just drift with whatever thoughts you have. Good. Now tell me your secrets.
I don't have any.
You must. Everyone does.
What are yours?
Sometimes I dream about someone very sexual, making love, holding them tightly, gently. Now you tell me one.
I used to like when Ellen would comb my hair.
Your brother?
He'd wash my hair in the summertime. We'd sit out in the garden. He'd comb it. And arrange it.
Well, if I stroke your hair, does that feel good? Julie, just let yourself feel. Don't be afraid. No, Julie. Come on. I'll be kind to you. I'll be gentle. Let me touch you. It's a beautiful place to be touched. It's so soft. I like to touch it. You like it too. Feel your heart. You're alive. You're happy. My little Julie.
Oh, don't.
I'll see you Friday, Julie, same time.
I didn't hurt your feelings, did I?
You're not helping me, Julie.
That doesn't sound like legitimate psychiatric help to me.
Certainly doesn't. Julie, did he continue in this way?
Yes. No. Hey, let me go. Go away.
You know me pretty well by now, Julie.
No.
White wine is what all the society ladies drink. They don't know it rots their gut. You like the fra jasmine? Oh, well. Oh, your white girl's just like her. You don't know nothing about my roots. Sure. The fra jasmine with the original jazz sound. They're the children of that sound.
My ex-husband tried to teach me to dance, and he said it was like dragging a dead carcass across the floor.
Oh, well, let me show you. What'd you say your name was?
Julie Roy.
Julie Roy. I like you, Julie Roy. Hey, why don't you take off your coat and relax a while? Are you ready for some breakfast now? Look, I didn't mean nothing by that. I mean, I just thought, you know, it's a hot night.
I hate July.
Oh, why is that? I said, why is that? Why are you so tense? Why don't you relax? Lean in. Let it happen. Hey, Julie, where you going? Ain't something to lose, huh?
Who is it?
It's me. Julie. I need to talk to you.
After 2 months, you need to talk to me.
Can I come in, please? Aren't you even going to offer me a glass of wine?
Here. Go ahead, drink it. I don't have any germs. Look, Julie, you come over here. You better fill me in on what's been happening to you. I mean, you haven't been playing fair with me.
You're not going to believe this. Nobody would.
Try me.
I think my doctor's making a pass at me. You see, I told you. I knew you wouldn't believe me.
And what makes you think that he is?
Well, I'm on the couch now. And he touches me.
He touches you? What the hell is going on?
I don't know. Don't you see? I don't
You
know.
don't know anything. You don't know when somebody really cares about you like I did. You are so messed up.
I'm not. I'm just scared and lonely.
You're scared. You're lonely.
I just
Did you
went
ever
to the
think
bar
about
and
me?
this black man tried
A
to...
black man? Your shrink? Who else are you playing around with? You're like some freak puppet on everybody's string. Get out of here. Get out of here!
I hate you.
Can I have a word with you outside?
Sure. We'll be right back.
Excuse us. You know what transference is? It's a psychiatric phrase, very common phenomenon. Basically, the doctor encourages the patient to trust him, to let him inside her ego, so to speak. That way he can get to the root of her problems and help her to solve them. That's in the normal course of events. But that kind of total trust also gives the doctor tremendous power over the patient.
Okay, wait a second. Now, correct me if I'm wrong. Are you saying that through transference, a doctor, if he wasn't ethical, could control his patient sexually?
Right. That's what the Hippocratic Oath is all about. You see, it strictly prohibits any kind of sexual relations between doctors and patients.
And do we have a case?
Maybe. It's a very tricky legal problem, and I want to research it first. I'll get back to you later, right?
Yeah, okay. Well, I'll be in the office. I'm sorry, Julie. Lauren will be back in a couple of minutes. Why don't we just continue?
Julie, I'm going to propose something to you I want you to think about very seriously, okay?
Okay.
I want you to think about you and I having sex.
It's not right.
It's done all the time.
Are you telling me the truth?
Julie, it's very commonplace. You must believe me when I tell you this. In psychiatric terms, it's known as transference. You learn to love me. Then you transfer that love to any man you find more suitable. You have a wonderful figure. So round, womanly. Don't be afraid.
It's absolutely outrageous. Medically, legally, morally wrong for a doctor, especially a psychiatrist, to try and cure a patient by having sex with her. It's wrong.
If she's telling the truth.
I'm telling the truth.
Julie, there's no doubt in my mind that you believe what you're saying is the truth, but I have no way to determine that.
But it is the truth.
Oh, come on, Julie. I've been sitting here listening to the story. I don't know what happened in that office. I have
That
to take
is
your
what
word
really
for everything.
happened.
Oh, Julie, come on. You want to know what really happened? What really happened is you fell for him. You had an affair with this guy. He dumped you. You
No.
feel rejected. Very reasonable.
No,
and now
he
you want to
used
settle
me.
accounts. Oh,
It
come
was
on, Julie.
wrong
You
what he
wanted
did to
it,
me.
Julie.
No, he used me.
Julie, Bob was testing you.
I'm sorry, Julie. I really am. I had to do that.
See, you're going to have to face much worse than that if we go to court. You're going to have Hartog's lawyer pounding you, trying to undermine your story. A case against a psychiatrist involving vague concepts is going to be very difficult to win. See, all we have is your word against his. We have to make sure you can stand up to cross-examination.
Well, I think I can handle it. If I'm sure that there's someone on my side.
Well, look, why don't we go for a walk, huh? Get some air.
You two go ahead. I have to finish some work. I'll see you later, okay?
It's not that we don't know how you feel, Julie, but it's a complicated legal problem. It's really a matter of whether or not we can help you. See, I don't understand why you stayed. Did you ever try to leave him?
Yes, once. This will pay my bill up to date.
You've been seeing Pat again. You've done one smart thing in your whole life, which is to come to me for help. I isolate your problem, I figure out a cure for it, and as soon as the cure becomes apparent to you, you turn away from me, you go back to the very thing you despise the most.
I've talked to her about you.
How long do you think it'll be before the feelings of guilt catch up with you again? A week? A month? It's not me you want to leave, it's her. Isn't that the truth? And you're afraid to? Afraid to break with her?
Yes?
You don't want to hurt her. I understand completely, but don't you realize that
It's crueler in the end to string her along. Make this break now. Put it behind you. Get on with your own life.
I don't know.
What you need is the love of a man, not of a woman. Don't you remember what I told you before? If you can learn to love me, you can then transfer that love to any man, and you'll be cured.
The next day I had an urgent message from Pat. She sounded desperate.
Pat? Pat? What? Oh, come here. Come here, stand up. Come here. Oh. Come on. Here. Come here. Put your arm around me. What did you do? What did you do? Pat, come on. Come on, just keep walking. Come on. Come on. Go.
How's your friend?
She'll live.
That's good.
Is it?
Most people would say so.
Is it worth living if you're unhappy all the time?
Maybe not, but who said we have to be unhappy all the time?
She left New York. For good. She can't stand the pressure of the city.
Most of the pressure comes from inside.
I feel terrible pressure. And sad. I feel so sad.
Julie, I've been thinking perhaps we should stop our sessions.
Why?
Because you're not willing to do what is necessary to get better. You're not willing to trust me.
I'm sorry, I will. I will. I promise. I promise. Okay.
Good. Take your clothes off.
After that, I just sort of accepted the fact that we would be seeing each other more. I went to his apartment once. I made dinner for him. I played the piano. He said I was very good. I felt like we were lovers.
Yeah, I told you. It works, doesn't it? Here, before you sit.
I had all this stuff. I was just afraid to use it.
You're afraid to be the best you can be.
And next week, I started working for him.
You work for him?
I'd do typing. He was writing a book.
Very good. Very professional. Much better than anyone I've used before.
Well, I'm really careful with it. I know how important it is.
Julie, we won't be able to be together tonight. Something's come up.
Oh?
Yeah, I have an emergency. A patient who is very upset who has to see me immediately. Of course, it's a nuisance, but...
Oh, you can't neglect the patient.
No, I can't.
I understand.
Julie, once more, thank you. Good night.
Who was she?
Are you spying on me?
No.
Good, I wouldn't like that.
I'm sorry. I'm sorry. I'm just jealous. Oh.
I shouldn't be angry at you. I should be flattered. You're very good at imagining things, my little Julie. Here. Take these. I don't like it when you don't sleep at night. It's not good for you.
What are they?
Tranquilizers. Take them every few hours if you feel nervous. Julie, would you please type this up for me?
Oh, okay. I'll bring them to you when I see you on Sunday.
I may not be here on Sunday, so I'll call you over the weekend.
But why?
I said I'll call you.
Last minute changes. They've got to go out today.
But this is a lot of work.
You can do it. On my desk by 5:30.
Hello? Hello? Yes, I typed them. Where were you? I waited all weekend. No, I can't bring them over right now because I have a lot of work to do. I'll bring them tonight, okay? I'm sorry, don't be mad. Hello? No, I'm not finished yet, but I promise I'll be there tonight. Send a messenger to my apartment. Okay. What time? Okay.
Understand what?
Everything's changing. I'm scared.
Julie, sit down. Now, what's wrong? Have you been taking your tranquilizers? This is a very busy time for me. As you know, I'm trying to finish my book.
I'm sorry. Forgive me, please. Talk to me. Be with me like before.
Julie, I have an emergency. I can't spend any more time with you tonight. I want you to go home, take 2 of your pills, and be calm and reasonable. Just take your pills. Everything will be all right. Go.
I hate you! 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 I hate you!
So that's when you asked Dr. Hartogs to recommend another psychiatrist to you? And that was Dr. Todson?
No. No, he wouldn't give me the name of another one, so I talked to my personal doctor, and he gave me Dr. Todson's name.
I think we should talk to Dr. Todson.
Are you going to help me? Are you?
We want to, Julie. Honestly, we don't.
Dr. Todson, do you feel Julie is hallucinating or delusionary about her sexual experiences with Dr. Hartogs?
From my observation of the patient, I would say that she's not.
How many times did you see her?
Several times. Only in consultation. Then I referred her to the postgraduate center for mental health.
And did she tell you what Dr. Hartogs had done to her?
Yes. And in my opinion, she'd been severely damaged by the treatment she received from Dr. Hartogs.
Could you tell us what your diagnosis of Julie was when you saw her?
I have it here somewhere. Oh, here it is. Psychotic depressive reaction, catatonic schizophrenia, hysterical personality with transient situational disturbance.
Doctor, do you think she's capable of standing trial?
Yes, I do. As a matter of fact, it might enable her to hold on right now. She's lost her belief in everything, you know.
Thank you very much for your time, Doctor.
All right, thank you. We'll be seeing you again.
I could kill that shrink for what he did to you. I really could. Want me to get it? All right. Who is it?
Bob Cohen and Lauren Blockman. They want to see Julie for a minute.
Let him in. Okay.
Hi, Julie. We've just come from Dr. Todson's office. We're going for it. All the way.
Julie, good news.
Julie, we're taking the case.
Julie! Julie, you know what this is?
I don't know.
This is a notice of a lawsuit. You're suing me for over $1 million. Do you realize what that means?
No, I think
Let's go someplace where we can talk this over.
No, I don't want to. No,
Julie.
no.
Now, you can go through with this thing. Don't you realize you make a fool of yourself? Come on now.
No.
Sick woman, no one will ever believe you against me. Come on. Come on.
No! Stop it! No!
All right.
What's wrong? What's your name? Can you tell me your name? Julie Roy. That's who you are? Oh, you want these pills renewed, is that it? How many of these do you take in a day? 6? Why don't you wait here? I'll just go check on these, okay?
You're Julie Roy? You came in last night? Well, we've called a cab for you, and these men will help you.
Open it up. Watch it.
Calm down. Come on. Oh, Jesus. Get her arms. Come on.
All right, come on.
Come on.
Calm down.
Come on, let's go.
Get the door.
Got it.
Don't look much like a bird to me. More like a drowned rat. Hey, rat, what you in for, huh? What you in for? Get back. Let me go.
All right, come on. Hey, come on, Mom. Break it up.
Naturally, we panicked when there was no answer. Julie, it took us all of yesterday and today to track you down.
We came as soon as we found out where you were. Come on, Julie, why don't you talk to us?
Visiting hours are over. Okay, 1 second. Julie, talk to us, please.
Julie.
Okay, look, we'll see you tomorrow, okay?
Now we have a client that won't speak.
Can't speak.
Can't speak, won't speak. We'll set a precedent, all right. The precedent of the speechless witness.
Get up. Get up. Help me pull her up.
Hi, Julie. I'm Dr. Rehnquist. We're going to give you some treatments to help you get better faster. Get you talking and out of that depression. Now, you just sign this release form and we'll get started right away. Trust me, Julie. Come on. Take the pen. Come on, Julie! Julie! Put her in isolation!
You can try to make me crazy, but I'm not crazy, and I won't go crazy, no matter how hard you try to make me crazy. I won't.
You're not strong enough to deny it.
I am strong enough.
No, Julie. The process of transference has taken over. I have transferred your will to mine. Now stop talking, get undressed.
I won't. You're not gonna use me anymore. No! Stop it! No! No! Stop it!
Trust me, I'm going to kill you.
You won't!
How do you feel, Julie?
It still hurts.
There'll be a lot more pain ahead.
I want to handle it.
No, it's still far from over.
I know. But I'm not so afraid anymore. It's like I had to go all the way to the bottom to start back up again.
Good luck, Counselor.
Oh, you too.
Why isn't Hartog's here?
Well, he doesn't have to be here unless he's going to testify. We're not sure whether he's made that commitment yet.
All rise. Trial term, Part 21, is now in session. Honorable Alan Murray Myers presiding. Please be seated.
Bring in the jury.
Caught a break with this jury.
Why? I thought you wanted single women who would be more sympathetic.
Working class blacks are better. They've been taken advantage of their entire life by professional people like hot dogs.
The case of Julie Roy versus Dr. Renatus Hartog. Counsel ready?
Robert Cohn, counsel for the plaintiff, ready, Your Honor.
And Victor Shaven, ready for the defense, Your Honor.
Counsel for plaintiff may proceed.
Thank you, Your Honor. I'd like to call the plaintiff, Julie Roy, to the stand.
Your Honor, I reserve my motion on the opening.
You can do whatever you want.
I don't want to make it in the presence of the jury.
The jury will please step out of the box.
Your Honor, I ask that this case be dismissed under the determination of Section 80A of the New York Civil Rights Act, which abolishes civil damage suits on the grounds of seduction. You will note the state Supreme Court precedent. As you can see, Your Honor, the case was identical, the doctor having sexual relations with a female patient.
Are you aware of this decision?
May I have a look, please? Thank you.
What's happening?
They're trying to throw the case out.
How can they do that?
Well, they can try anything they want to. It depends on Maya's rules.
Your Honor, these two cases are entirely dissimilar. The physician cited here is a gynecologist, not a psychiatrist. We maintain that it is fraudulent for a psychiatrist to have relations with a patient under the guise of legitimate therapy. Section 88 does not give carte blanche to a psychiatrist.
It would appear that the key here is informed consent. If the patient was physically or mentally unable to resist, then it would seem that 88 would not apply.
That is precisely the basis of our case, Your Honor. We intend to prove that through the psychological process known as transference, our client was deprived of exercising informed consent, exactly as if she had been drugged or literally tied up.
Return the jury. You may be seated, gentlemen. I'm in the process of acting on a motion by one of the attorneys on a point of law. Therefore, I will recess this trial until 10 o'clock tomorrow morning. And the sooner you get me the brief, the better.
Please rise.
What are we going to do?
Prove his case isn't relevant.
we can. Marge, do you have that file?
Yes.
Sister surgeon?
Yes, it is.
Be sure.
Transference. A psychiatric phenomenon common in almost all analytic relationships in which a patient is deprived of the ability to use his own judgment. Similar to the relationship a child has to its mother and father, trusting the therapist implicitly as to all decisions. Precisely because of this effect on the patient, sexual relationships between a psychiatrist and a patient are forbidden.
Yes.
Your Honor, my brief.
Oh, yes, Mr. Cohen. I suggest you freshen up before court. Wine.
All rise. Be seated.
In the opinion of the court, Section 80A does not apply in this case.
You had sexual relations with Dr. Hartog's, so you claim.
Yes. I had sexual relations.
Didn't you fall in love with Dr. Hartog's? Isn't that really what happened? Regardless of the alleged sexual relations?
Yes. I fell in love with him. And I assumed he was in love with me.
And how did you arrive at such an assumption?
Because he told me he was.
And when he stopped having these alleged sexual relations with you, you felt jilted, didn't you? Like any woman feels when she stops having relations with any man.
I felt betrayed, not jilted.
Isn't it true that you entered into this alleged sexual relationship with a clear mind, knowing full well what you were getting into?
I entered into a sexual treatment. It wasn't a spontaneous relationship a woman normally has with a man. He told me I had to do this to get better.
Miss Roy, while you and Dr. Hartog's were allegedly nude on his couch, allegedly making love,
There was no allegedly about it. Will you stop saying that, please?
while you were doing this, did you have the lights on or off?
There was one light, and it was on.
So there's no question that you were able to see Dr. Hartog's body clearly.
That's right. Yes, I could see it.
And during all this time that you were allegedly making love, did you notice anything on his body that was abnormal?
No.
Didn't you tell this jury that you, quote, felt his body, every part of his body?
Yes, I did.
And you saw nothing abnormal?
No. There was nothing abnormal there.
Dr. Von Hoving, could you tell us, please, if any branch of the psychiatric profession has taken a position condoning sex between a psychiatrist and his patient?
None. In fact, there is specific and special interdiction that this is not an operational device open to a psychiatrist. The APA has specifically said that this is not a matter of individual judgment. It is unequivocally, without question, not to be done.
Under no circumstance?
Absolutely none.
I see. Continue.
Thank you, Your Honor. Could you tell us what harmful effects can occur if a psychiatrist has sex with a patient?
It can be disastrous. It's as if the patient were to have sex with her parents, because the psychiatrist takes on the role of the parent. The patient loses sense of what's right or wrong.
I see. In other words, this woman who went to a psychiatrist for help may now be so disturbed that she'll never be able to get the help that she went for in the first place.
Unfortunately, yes, that is true.
Thank you very much, Dr. Van Hoving. I have no further questions, Your Honor.
No questions, Your Honor.
Down, Doctor. Thank you very much.
All rise. Term trial part 21 is now in session. Honorable Alan Murray Myers presiding. Be seated.
You may call your first witness.
Dr. Renatus Hartogs.
Raise your right hand. You swear to tell the truth, the whole truth, nothing but the truth, so help you God?
Yeah, I do.
You may be seated. Counsel?
Dr. Hartogs, will you please present your credentials?
I was licensed as a psychiatrist by the state of New York in 1955. I am the senior psychiatrist at Sing Sing Prison. I am a member of the American Medical Association, the New York Society for Child Psychiatry, as well as a dozen other psychiatric societies and associations.
Here is a list of the organizations of which Dr. Hartogs is a distinguished member. Dr. Hartogs, describe for us your first meeting with Julie Roy.
She came to me on a weekday afternoon. She sounded so distressed over the phone that I canceled my regular appointment so she could come right away. This is something I rarely do. The first session, I elicited information from the patient such as age, background, marital status, etc., and asked why she wanted treatment. She was confused, depressed, unhappy. It was immediately apparent to me that the patient was exceptionally distrustful and incoherent. She didn't answer some of the questions, and she stated that people were after her. She hated her parents, her teachers, anyone that she had grown up with. It was clear by the end of the session that the patient was a paranoid schizophrenic with catatonic features.
That sounds like she was rather sick.
Extremely, yes. I agreed to see her twice a week.
Please describe these subsequent sessions to the court.
Well, they generally followed a similar pattern. The patient often would be incommunicative and depressed. Then she would get angry and tell me how much she hated me. See, she was using me to work out all her pent-up hate against her parents, lovers, and the like. Now, very often a schizophrenic patient such as this one actually will come to believe that the therapist is all these other people.
As your treatment progressed, did she become any more trustful of you?
No, I was always very friendly and encouraging.
But she said to me time and again, I don't trust you. At one point, I became so frustrated at my inability to break through that I suggested that she switch to a female therapist, but she refused to even discuss it.
Now, Doctor, I'm going to ask you a very direct question, and I must have an absolutely truthful answer. Did you ever, at any time, have any sexual relations with this plaintiff?
No, absolutely not.
Did you ever love this person, or did she ever love you?
No, never. She hated me from the beginning to the end.
Now tell us, Doctor, based on your many years as a psychiatrist, does a patient who suffers from this type of paranoid schizophrenia really believe what they say?
Absolutely.
So if she says she had sexual relations with you, she really believes it?
Without question.
Can she tell the difference between reality and delusion?
No, to her, they are the same and always will be.
Thank you, Doctor. You've been most helpful in what must be a very trying and difficult situation.
If you've done, counsel, we'll begin cross-examination. Mr. Cohn.
Oh, I'm sorry, Your Honor. I do have a few more questions.
Well, move it along, then. Move it along.
Dr. Hartogs, do you have a gross imperfection on your body which is clearly visible?
Yeah, I do.
And what is that?
It is a painful sexual disfiguration which I received in 1940 when I was kicked by a Nazi guard in a concentration camp.
I place this photo in evidence. Now, tell us, Doctor, is it true that you have not engaged in any sexual activity since 1965?
That is correct.
And why is that?
The tumor makes it impossible for me to have it.
In other words, because of this tumor, you have been impotent since 1965.
Unfortunately, that is true.
No further questions.
I'm sorry, Julie. I just don't understand. Explain it to me. Please, explain it to me. All those times lying naked with him on the couch, how is it possible you could not have seen it?
It wasn't there. I didn't
Oh, come
see
on,
it.
Julie. You saw the pictures. We all saw the pictures.
All right.
Everybody saw the
It's all
pictures.
arranged. Will be examined by an impartial urologist first thing tomorrow. Maybe we'll learn something.
The doctor will see you now, sir.
Thank you.
Yeah, well?
I don't know how to tell you this.
What?
Those pictures weren't lying. There is a tumor of a very special type, which has never been known to cause impotence, which can be drained in a matter of minutes and almost totally reduced. In fact, the procedure is so simple that Hartogs could do it himself.
You're kidding.
And no one would ever know that he had it.
Julie, please forgive me the way I behaved last night. Oh, am I going to nail that? Dr. Hartogs, did you ever give Miss Roy a physical examination?
No, my office is not equipped for that.
So without knowing anything about her physically, you went ahead and prescribed the following drugs? Valium, Thorazine, Stelazine, Preludin, Librax, and Librium?
That's true. But not all at once.
Those are depressants, aren't they?
Tranquilizers, yes.
It would be possible to commit suicide if an overdose of the aforementioned drugs were taken?
That would be true with almost anything.
Dr. Hartogs, do you subscribe to the American Psychiatric Association's canon prohibiting sex between psychiatrists and their patients?
Yeah.
Mm-hmm. And that's your personal professional opinion, too?
Yeah.
Have you ever had sex with any of your patients since your psychiatric residency?
No.
And you never had sex with Julie Roy?
No, never.
According to your testimony, you have been unable to have sexual relations since 1965.
No.
No? You mean you have been able to have sexual relations since 1965?
Well, I could, but it is too painful.
Oh, I see. So you're not really impotent, as you had testified previously. Rather, it's just too painful to have sex.
That's correct.
When did you first discover you had so much pain?
In 1964.
And that's when you stopped having sex?
In 1965, yes.
Dr. Hartogs, are you aware that this type of tumor can be drained by a simple procedure so that everything appears to be normal? A 10-minute procedure, so simple that you could perform it on yourself?
I had it done once, but it didn't work.
I see. And on that one occasion, did the draining leave any mark?
No.
So if you had had it done, then there'd be absolutely no way to tell, even if the lights were on.
That is correct. But I didn't have it done again because it didn't work.
That man is guilty. There was no question about it. We should have had him nailed. We should have had him nailed.
Bob, you know a lot's going to depend on the final arguments tomorrow.
Yeah, but damn it, come on, Lauren, that tumor exists. We can't deny it. There are pictures of it. And they're going to have those pictures with them in the jury room tomorrow.
They're also going to have the urologist report.
Lauren, I don't have to remind you the burden of proof is on us. All that man needs to walk is reasonable doubt. Yeah? Oh? No way. Anybody know Carol Stockwood?
No.
No, look, we're pretty busy up here. We don't have time. She says there's a woman out there who has something to tell us about the case. A matter of life and death.
Why not? What have we got to lose?
Okay, send her in.
Stockwood, right?
Mm-hmm.
Hello, Miss Stockwood?
I know it's late.
It's no problem. Won't you have a seat?
I've been coming to the trial every day.
Can I get you a cup of coffee or something?
No, please, let me say what I came to say before I'm too scared. I was a patient of Dr. Hartog's during the same period that you were his patient. And
Are you ready for your summation?
No, Your Honor, I'm not. May I approach the bench?
Yes. Now, what's this all about?
Your Honor, we've uncovered a witness who brings new evidence to this case. Evidence we feel is crucial to a just and a fair trial.
It's very irregular.
It's not only irregular, it's preposterous.
Your Honor, this witness will be the most important person to testify at this trial with the exception of the principals themselves.
Well, I'll let you start it. But if I feel you don't go to the heart of the matter, I'm going to stop it.
Fair enough.
Now, you can proceed.
Thank you. Call Carol Stockwood, please.
Carol Stockwood, stand.
Raise your right hand. You swear to tell the truth, the whole truth, nothing but the truth, so help you God.
I do.
Please be seated. Counsel.
Mrs. Stockwood, were you ever a patient of Dr. Hartog's?
Yes, I was.
During what period of time?
From 1967 to about a year ago.
Did there come a time after your treatment with Dr. Hartogs began when you and he had sexual relations in his office?
Yes.
When did it start?
Approximately 2 weeks after we started treatment.
There will be absolute quiet during this testimony. Continue.
How often did you have sexual relations with him?
About once a week. Sometimes more.
From the beginning of your treatment until you stopped seeing him a year ago, without interruption.
Yes.
Mrs. Stockwood, did you ever see Dr. Hartogs nude during this period of time?
Yes.
And did you ever notice anything wrong with his body?
Absolutely not.
Mrs. Stockwood, did you ever instigate sexual relations with Dr. Hartogs?
No.
Then why did you do it?
It was a very depressed period of my life. My husband and I were separated, and I was under a tremendous strain to support my 3 children. I was recommended to Dr. Hartogs by a friend. He told me I had to have sexual relations with him because I was being deprived of love.
Did you improve under his treatment?
No.
Your Honor, I can no longer tolerate this line of questioning. The court is permitting another case to be tried in this case.
I admitted this proof for one purpose and one purpose only. The defendant testified that for more than 10 years, because of some physical ailment, he had no sexual relations. Now, this lady is telling us that during that period, she had sexual relations with him.
I move for a mistrial on the grounds that this witness's testimony is highly prejudicial.
Your motion is denied. Do you have any further questions for this witness?
No, Your Honor.
Do you wish to cross-examine? Sir?
No.
May step down.
Excuse me, Your Honor. May I ask the court's indulgence once again?
Well, what is it now?
Some new witnesses have come forward who wish to testify in this matter.
How many witnesses are there?
4 so far.
Bailiff, hand me the verdict of the jury. The question, did the defendant, Dr. Hartogs, psychiatrist, induce the plaintiff, Julie Roy, to have sexual relations with him while she was his patient? And did he, in fact, have such relations with her? The answer is yes.
Thank you, sir. Congratulations. Gentlemen, please. Can we get some more security here, please?
That's right. You've been awarded $350,000 worth of damages. How do you feel?
Thank you. Congratulations. Congratulations. I feel stronger now, and I'm hoping that someone else won't have to go through what I did.